Applying topical medication. Gather the equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patient. Perform hand hygiene. Prepare the medication for one patient at a time. Read the medication administration record and select the proper medication from patient's medication drawer or unit stock. Compare the label with the MAR. Check the expiration dates and perform calculations if necessary. When all the medication for one patient had been prepared, recheck the label with the MAR before taking them to the patient and return the medication stock to the patient's drawer. Transport the medications to the patient's bedside carefully and keep the medications in sight at all times. Ensure that the patient receives the medication at the correct time. Identify the patient. Usually, the patient should be identified using two methods. Check the name on the patient's identification band, or if the patient cannot identify him or herself, verify the patient's identification to the significant others. Complete necessary assessments before administering medications. Check allergy bracelet or ask patient about allergies. Explain the purpose and action of each medication to the patient. Perform hand hygiene and put on gloves. Use non-sterile gloves unless the skin is broken, then apply sterile gloves. Wash, rinse, and dry the affected area with water and clean gauze. If skin is very dry and flaking, apply topical medication while skin is still damp. Change gloves and perform hand hygiene in between. Use sterile gloves for open skin lesions. Place required amount of medication using a cotton tip applicator. Note that the cotton tip applicator is sterile and is for single use only. Let the patient know that initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Observe signs of irritation or redness. Perform hand hygiene and document the procedure in the patient's chart.